Hi CAM followers, and welcome to this evening's live event. I am very lucky to be joined by Diane. Some of you who are loyal followers will know or recognise her. Thank you so much for joining us again this evening. We're going to be talking about physiotherapy and how we can use physiotherapy in osteoarthritis cases in different situations. But before that, I would just like to say thank you to our sponsor. If you just bear with me 1 second, I'm just going to bring up a little video. I would like to make a big thank you to our sponsor. So Big Barker have been incredibly generous and helpful to us with us all. So we'll just get that playing for a second. Hopefully that's working. Fabulous. Right. Anyway, lovely to have you here this evening again, Di. If you'd just like to introduce yourself to everyone, for those who haven't met you before, about what you do, what you've been doing, that'd be great.
Thank you, Charlotte. Hi, CAM followers. Yes, my name's Diane Messum. I'm a Chartered Physiotherapist, now specialising in small animals. And I work at a small animal referral hospital in Hertfordshire, where we work alongside up to 13 specialist services, which include orthopaedics and neurology. And we work particularly closely alongside the anaesthesia team as well to deliver the pain clinic that we provide there. So I've been there just over 10 years, and we've grown a lot during that period. And we have a wonderful venue with a hydro suite, gymnasium, and consult rooms there. And yes, it's a brilliant place to work. But as Charlotte's already alluded to, we're going to be talking about practical physiotherapeutic approach to osteoarthritis management. And so we'll be revisiting quite a lot of what you have heard from me in the past, maybe, or touching upon areas and covering a little bit of new stuff too. But hopefully I'll be covering stuff that you can implement yourselves at home without necessarily needing a big budget. Look at others that I consider adding in management and optimising function in our pets with osteoarthritis. So yes, that's what we're going to be covering this evening.
Fabulous. That sounds great. Sounds very helpful.
All right. So anything else you wanted to add before I launch in, Charlotte?
No, I think we're good to go.
Okay, we're going to try and switch to the slides. So bear with us a second while we just switch over.
There we go.
Okay. Are we still there, Charlotte?
Yep, we're all good.
Brilliant. Okay, so first of all, I wanted to cover what is physiotherapy for those of you out there that aren't really sure what physiotherapy entails. And I think largely it's a term used to restore and maintain movement and function, particularly when someone's affected by injury, illness, or disability. And we use several techniques in order to do that, which includes movement and exercise, manual therapies, electrotherapies, and a lot of our job as well covers advising you, the pet owner, on what you can do for your pet at home too. So we're going to be covering a lot of that tonight. It's a science-based profession, and we look at the whole person when we are assessing them. So we'll look at their lifestyle, what's going on behind the scenes at home, as well as obviously what we have in front of us as well when we do our physical examination. And at the core is the patient's involvement in their own care. So in our case, in your case, it's the pet owner. Mm-hmm. And we're educating you, the pet owner, raising your awareness of the condition and empowering you to participate in your pet's treatment. So obviously, we've changed some of the terms within that quote. Generally, or broadly speaking, it's mainly musculoskeletal, neurological and respiratory physio we would cover within our field. But it's also further divided into orthopaedics, or outpatients. We see patients with stroke rehabilitation, there's sports physiotherapy, hand therapy as well, burns and plastics. So there's lots of different areas that we cover, particularly when we first qualify. And if we go into a hospital role, we will cover all of those disciplines before we decide on an area we want to specialise in. But broadly speaking, our main aims are to reduce pain. We want to promote any healing processes following injury. We're looking to increase and maintain muscle strength and joint range of motion. We're wanting to really promote and restore normal movement processes and also improve cardiovascular and respiratory fitness too. So where do we fit within the veterinary team? And we hope that we're integral or an integral part of the multidisciplinary team. And we're using the same principles of assessment, treatment, planning, and clinical reasoning as a human physiotherapist would be. So we've got on the left-hand side of this slide here, we've got the veterinary surgeon whose role is to assess and obtain a diagnosis and prescribe medical or surgical treatment. We've got the veterinary nurse who will determine the care needs for your patient. And then you've got ourselves, the veterinary physiotherapists, which are designed, we are there to assess the physical function and create a physical rehabilitation treatment plan. And as part of that, so our assessment, we'll be looking at a number of factors. We'll be assessing your pet's gait, we'll be looking at them in standing and looking at their posture and how they're distributing their weight. We'll be then doing palpation to examine superficial heat or swelling. We'll be looking for deeper tissue palpation as well and looking at localized areas of muscle spasm or overactive tissues. And we're really looking at what is normal. And we might use one side of the body to the other. So if one leg is particularly affected, we'll be comparing that to the other side. We're looking for skeletal or muscle asymmetry as well that can tell us a lot of information. We're going to be looking at postures, changes in postures or adaptive postures. And as part of our assessment, we'll be looking at joint restrictions and end feels as well. So, and that's a point at which we'll be coming on again in a second. We're feeling for fluidity of movement and compensatory soft tissue problems and looking at areas that need to gain strength, stability and condition really overall. So when should physio begin? Well, we recommend that it's as soon after diagnosis, surgery or injury as possible because we're more likely to achieve better outcomes. And particularly for those younger dogs as well, a regular physiotherapy assessment from a young age is going to be beneficial because we're there to help you identify problems early and help you understand how you can help your pets lifelong after that.
Can I just ask a question there, actually?
Of course you can.
So obviously, if we've got animals that actually, I've had a few cases recently where gait analysis has been brought up and mentioned. Are there specific, let's say, breeds in particular that you would recommend to go from a younger age to go for kind of monitoring with things, or any particular issues in particular you think would be helpful to actually get on top of sooner rather than later?
I think there are obviously going to be certain breeds that are predisposed to certain conditions. And I suppose the one that springs to mind, purely because I've seen so many of them in the last few months, is Labrador Retrievers. Yeah. And it's so heartbreaking because I've been seeing them from the age of 9 and 10 months of age. Yeah. And one in particular came to me fairly recently, back in January, and had significant bilateral dysplasia and significant effusions, which is another term for swelling of the elbow joints. So this dog has all 4 limbs already significantly affected with biomechanical problems that are going to obviously ultimately affect its joints long term as well. So we started treatment and advice, and the owner was super compliant. We discussed the need to go for an orthopaedic consultation because he hadn't at that point. And so he's just fairly recently had an orthopaedic consultation and underwent arthroscopy of the elbow joints just last week. And ultimately he's going to probably be a candidate for total hip replacement surgery. But certainly I think it was helpful in that case and others as well that came at a similar time to identify those problems early, because we can manage it a lot more effectively sooner rather than later.
Okay, so I have a particular case that just pops into my head where actually the owners had noticed that their animal wasn't when they ran, they had a slight odd gait to them, which was getting worse as they were getting older. There was no lameness and there was no pain or any issues on clinical exam. Would it be useful? I mean, obviously the sooner the better is always ideal, really. But if you were to find small changes in their gait that's starting to change, we suspect because their anatomy is not quite 100% as it should be, are those cases that you would get in, analyse, and then get onto a treatment plan that you could implement regularly?
I mean, absolutely. I mean, we have cases that come to us from the referring vet where the owner has approached in the first instance and said, my dog has started to bunny hop, for example, or running in an unusual fashion to what they know it to be as. So they've sought their opinion. They've done a workup within their own practice. The x-rays have been largely unremarkable, maybe had mild signs of hip dysplasia. So they've come to us, and, you know, some of these dogs can mask underlying problems very easily, or they might not necessarily have an underlying problem, but there's something or that's visibly seen, but there's something going on that suggests there's some pain presence, or that, you know, there's movement changes. So we need to do a full musculoskeletal assessment to really identify whether there is anything we need to address, because it could, you know, if there's nothing on radiographs, for example, it could be a muscular problem that we could identify at the time of assessment.
Okay.
So yeah.
Thank you. That's really helpful. Thank you.
So our assessment really is going to be ultimately creating a problem list. So we have that problem list in front of us, and that will allow us to create a treatment plan. And that's going to be done with you, the pet owner, and the veterinary surgeon as well, making sure it's appropriate for your pet. Our assessment tools help reevaluation of the treatment plans. If you're coming for repeated visits, and that might be every week, every 2 weeks, every 3 months, every 6 months, depending on what is practical for you and your pet and the whole circumstances, really. So it's going to help us reevaluate that treatment plan that we've suggested previously. And it also allows us to reflect on our practice to make sure what we're doing is working. And also we're going to be looking at constantly reviewing the evidence that's out there as well for use of certain treatments for this condition. So yes, we want to make sure that what we're doing is right and going to be benefiting your pet. And it also allows us to effectively communicate with you, the pet owner, what's going on with your pet. So, and you know, for you to make the changes at home and get you on board really with the management side of things. So our overall aim in managing the osteoarthritic patient is really to manage pain. We want to look at optimizing your pet's function and improving ultimately their quality of life. So I can't remember whether I've revealed this slide previously, but in human medicine, we have what's called the NICE guidelines, which is the National Institute for Health and Care and Excellence. And these evidence-based recommendations developed by independent committees, professionals, and some lay members as well, designed really to allow patients or you, the pet owner, to access the best treatment out there based on what we know from evidence and from research, essentially. And so you'll see the bit I've highlighted in the centre looks at the core treatments. So these are the three main things that we know is going to work in improving pain and optimising function. And obviously this is pertinent to our people, in human medicine, but we can still know that this is going to work as well for our own patients. And those three key things are information, exercise, and weight loss. And so for the first part of the talk, we're going to be covering all of those areas as well. And what's key thing is to know that this is these are things that are advised irrespective of, you know, your background, your budget, your patient's age, or comorbidities. Essentially, it's something that we can do from the word go. So what this allows us to, our assessment now is going to allow us to inform you about the disease process. And if it hasn't already been identified as osteoarthritis, we may have picked up findings on our assessment that suggest there's clinical signs of osteoarthritis. And if that's the case, then we'll go back to your vet and say, listen, there are clinical signs that there's changes within the joint. I think maybe if you proceed with any radiographs that haven't already been done, then that might be a point at which they take. Or we might just treat our findings and go forward from there. So at that point, we're also going to be questioning what you want for your pet. What are your goals for your pet? and looking at realistic goals, I think, and that's where we're going to set them together. So you'll see the term SMART, and some of you may have heard this, but SMART is really designed at describing specific goals that are going to be measurable. They're going to be achievable. They've got to be realistic, and they're going to have, ideally you'll have a timed factor as well. So for example, you might say, okay, I want to walk my pet 100 meters to the park twice daily. We've got to say, is that going to be achievable? Considering your pet's condition, looking at the terrain at which they've got to get there. Is it up a hill? Is it across a, uneven surface? Is it going to be realistic for your pet? And so we want to try and look at setting these short-term goals and long-term goals as well in many circumstances. And your compliance as a pet owner is of the utmost important for a successful outcome in your pet as well. So it's really finding a goal that's going to be achievable and result in a successful outcome as well. So part of our assessment and information gathering as well to enable to educate you is going to be looking at obtaining a complete social history. So there's lots of pictures on this image which are there for a reason. So we're going to go through each of them one by one. So the first one is really, do you have other pets at home, and how interactive are your pets with the others around the home? They may be cats, not just other dogs as well. And if they're very playful with each other, then is that going to be causing some acute inflammatory flare-ups within the disease process? And how are we going to best manage that, essentially? Next one along the top is whether there's a young family at home. Are they going to be out in the garden playing ball and frisbee with your pet? How much interaction do they have? Then we've got whether they're exercised on or off the lead as well. So what's their normal exercise routine? How long do you go out for? What's the terrain that you exercise on? Are you out with other dogs? And are they on or off the lead? And if they're off the lead, are they really doing the distance that you're set out to do, both of you, or are they doing twice the distance that you're doing, essentially? So they're running all over the place. We just don't know what they're doing. So really getting an idea of how long they're exercising for, but not only that, what's the distance that they're covering. Then you want to know whether they've got a large or small garden. What are they doing when they're in the garden? Are they racing to the bottom of the garden because a squirrel shot at the tree? Or is there another dog What stairs at home? These are the stairs inside or outside the house. So you can see there's a young pup there struggling to climb up a standard step height. So we want to know, normal flight of stairs. How often are they doing the stairs a day? I think that's really important. So I ask the owners, does your pet have access to stairs? Do they go up and down it? And how many times a day are they doing it? Because if they're doing it 20 times a day, then not such a good solution if you've got a dog with elbow osteoarthritis. If they're doing it twice a day, going up to sleep and coming down in the morning, and they can be supervised or mildly assisted in some ways, then that might be a solution. Or if they're coping with that under their own steam, then that's fine too. So it's really looking at that in more detail. Then we come on to bedding as well. Is the bedding easy to get onto and off, or is there a lip that they're really struggling to step over, and how comfortable it is for them? What's the flooring like at home? Is it slippery? Are they struggling on that, particularly when the postman comes to knock? Are they racing across the kitchen floor and scrabbling to get to the front door because they want to chew the letters as they come through the letterbox? And then finally, access into and out the house as well. And what's that like? Have they got steps, or is there a large threshold that they're really started to struggle with? So those are the sorts of things that you might be asked when you have your assessment. So when it comes to home modifications, what can you do at home to help? So these are some suggestions. And so if you've got some wooden decking outside, you might consider laying down some artificial grass to improve grip traction, because if that decking's wet during the rainy periods, then they're going to be vulnerable to slipping and sliding. Then you've got non-slip rugs to reduce the slick, or address the slick flooring that you might have at home. So look at the areas that they're accessing most, and looking at the high traffic areas for your dog by laying down rugs and runners. You've also got the anti-slip tape as well. So if there are some small slippery areas, that can be useful as well at utilising that. There are assistive devices on the market. Again, it was covered a couple of years ago in another talk I delivered for CAM. So do revisit the YouTube channel and have a look back at that. But this one here in the image is a help them up harness. And you can see it's a 2-part harness, which has 2 handles. So one at the front and one at the rear. And particularly useful for dogs, whether they've got forelimb osteoarthritis or hind limb osteoarthritis as well, particularly if they've got to do stairs. You might be living in an apartment or you know, they can't avoid doing steps or stairs. Well, this can be very helpful for those older patients that are really starting to struggle and need some assistance. Then you're looking at rugs or doormats as you come into the house. So sometimes we might not necessarily have a doormat through the door. So you want dogs to become a bit because they know from outside on a sort of asphalt, sort of fairly good surface onto a slick surface. It's a bit worrying for them. So worried about you losing their control and balance. So you could also consider if you've got a large step height into the house as well by just breaking that up with a small step, which you can see in the second image on the bottom. And then ramps into and out the car, particularly for those larger breeds that it isn't practical to lift them in and out of the car or assist them in and out of the car yourself. Look at some good ramps on the market. So the one we have within our centre is one by PetSafe. There are other ramps on the market, but I have to say the extra large PetSafe one that we have is fantastic. It's got a good grip. It's not the smallest on the market, so really look at whether it's going to fit into your car. You can get ones that just slide in on themselves, so you've got just 2 layers, I suppose, but there's also a trifold one or I can't remember what the term is that they use, but essentially it does come down a bit smaller. And like I said, you can get ones that are slightly narrower or slightly wider. Now, quite often we've had patients referred to us that have whose owners have already taken it on board to purchase a ramp. I've heard the term quite often during the assessment is, we've tried a ramp, but my dog's absolutely hated it. And usually when I question them further, it's because they haven't introduced their dog to the ramp in the best way, the way we would recommend. I think they've immediately put it onto the back of their car, immediately thought that their dog is going to walk up that ramp straight into the car and come straight back out of it without any problems. But I think if I was the dog being asked to walk up a narrow, slim incline up into the car and the dog owner's on one side and there's nothing on the other side, I think I'd probably be a bit fearful as well of falling off the other side. So I suggest, if they've had a bad experience already, I suggest going back to square one and just laying it down in the garden on a flat surface to start off with. And then they may have a small step in the garden that they can just put it onto. And I suggest having a second person as well with you whilst you're doing it for the first time or second time as well. So you've got one person either side of you. Take some rewards out, have some treats present so you can encourage your pet up that ramp into the back of the car or up the step initially, and tell them that, make it a positive experience for them and just gradually increase that incline until you feel you're at the height of the car boot. Other things to consider, raised food bowls as well. So dogs with forelimb osteoarthritis benefits hugely from food bowls being elevated because they're reducing the load on those joints as well. Which can make it very uncomfortable for them. So those are things that you can do at home. Any questions so far, Charlotte?
No, it's all good. The only thing I'll say is it's really, really helpful because we do have clients who get those either into their car or they get some steps for going in onto the bed and they just say, no, my dog doesn't want to use it, will just jump straight past it. And it is important to realise that we need to introduce these guys to these aids to get them the best use out of it. So yeah, thank you.
Absolutely. So what we're going to do is jump on to exercise therapy now. So if you flash back to the NICE guidelines, you'll recognise that the second on the list was exercise therapy. So what is exercise or, I know I've used the term therapy here, I suppose, because for the group of patients we're talking about here, it is a form of therapy. So it's a regime or a plan of physical activity or activities designed and prescribed for a specific therapeutic goal. And we want to try and restore normal musculoskeletal function and or to reduce pain caused by disease or injury, so osteoarthritis in this case. And I think when it comes to exercise, there's two ways of looking at it. In many ways, you could look at it before any injury. So we're being very proactive in this situation. So, and we use it to condition soft tissues and condition the body, and for injury prevention as well. But in most circumstances, we're probably a bit reactive to it, with the use of it, and we're using it for injury treatment and rehabilitation. So there's different types of exercise therapy. There's aerobic, which is you taking your pet out for a walk. You'll recognise this person in this image. This is Louise Clark, who's one of our anaesthetists who we work very closely with. And this is her dog, Billy, who he's approaching his teens, but I can't remember his age off the top of my head. I'm sure he's about 11, 12 now. But he is fantastic. And Louise does an awful lot with him to look after him and his body. And I think this image was a couple of years ago now, but there's no stopping him. So aerobic exercise, Louise does take exercise seriously, and you can see them enjoying it together there.
Yeah, brilliant.
So targeted strengthening is another type of exercise therapy, and we're going to cover that in more detail shortly. And then there's flexibility exercises, which is your ability to maintain range of motion with the joints and also maintain muscle length as well. And at this point, I should say that, and we're going to cover the reason for this, some people might consider this before analgesias or additional therapies, and it could be something you can utilise, and we'll look at why that's the case in a second. So using exercise to manage clinical signs, it's used for weight management and to maintain muscle mass, and improve strength and range of motion. Now, the way I describe making examination is the nervous system is acting as the biological scaffold for our body, for our underlying skeleton. And if we have a weak scaffold, that underlying structure is going to be more vulnerable to loading forces. So the muscular system is designed to, or when it's strong, is hopefully going to be offsetting those joint loads and minimizing the progression of osteoarthritis, which is why exercise therapy is so important, particularly with the targeted exercises. So the muscles are also acting as shock absorbers. So some of you may have heard it referred to as that also. And then finally, it can be used to reduce the need for pain relief. And we'll talk about the hyperalgesic effect of exercise in a second. Here we go. So exercise-induced hyperalgesia or pain relief. Now, this is becoming a more proven phenomenon now, or a proven theory, I suppose. Mm-hmm. But there's two ways that exercise can induce a pain-relieving effect. And one of them is being that it activates the opioid system. So you get that endorphin release, that feel-good factor. And we can see that's becoming elevated in plasma levels, in the blood levels, and the cerebral spinal fluid as well. And then there's the non-opioid exercise-induced hyperalgesia. And one of the main theories is it's doing this via the gate theory of pain. So what the gate theory of pain means is that there's describes how non-painful sensations can override and reduce painful sensations. So it's blocking the transmission of pain through the transmission cell to the brain. So you can see in that illustration, you've got your A delta and C fibers, which are your small peripheral nerve fibers, and those are your main pain fibers and nociceptors. And by stimulating the larger nerve fibers, you can transmit messages to the transmission cell a lot quicker and block the transmission of pain to the brain. And this was a theory that was this was proposed by two guys in 1965, Melzack and Wall, and has been used since. So that's encouraging. So moving on, so there's we're going to look at now what's the research for osteoarthritis in people, because there's very limited research in animal models, although there is a growing body of evidence there. But at the moment, we're probably pulling a lot of our knowledge from human medicine. And these are three key papers that have looked at the effect of exercise for osteoarthritis of the knee in people. Also, review and systematic reviews is really a fancy term for a summary of all the literature on a particular topic that meets a predefined eligibility criteria. So the authors of these papers have looked at a criteria. They said, okay, the research must have these elements to it to be included in our systematic review. And what they'll do, they might start off with 250 papers, but if they don't meet the eligibility criteria, they might only end up with 12, 14, 20 papers that they then look at in much more detail. And they look at what all of those papers say and come up with a sort of an overall summary on the effects. So one of the papers is a Cochrane review, which was last written, this one was written in 2015, and it looked at the effect of exercise for OA of the knee on pain and function. So there's 44 of the papers within that study looked on function, 44 of the papers looked at the effect on pain, and 13 of those papers looked at the effect of quality of life. And you can see that there's a moderate effect on function and pain, on exercise on osteoarthritis, and a small effect on quality of life. And that doesn't sound amazing, but in research terms it is, and so we should be we should look at that with great positivity. So the other slide I've got here, and I didn't know whether to add this in because I don't want people to go away and think, oh, actually, exercise can replace medication. That's not what I'm saying here. But this is what they found in human medicine, that the benefits of exercise can be as good as medication or as effective as medication, but with fewer side effects. So you can see the top 4 bars are looking at different medications. And then the lower 4 bars are looking at the effect of exercise, and that's water exercise, aerobic exercise, strengthening exercises of the hip and knee. And you can see the size of those bars on function and pain. So it's at this point I probably want to say that I have a lot of owners that come to me and they say, oh, I don't want my pet on pain relief long term, or they've stopped it prematurely before they've got to see me, and I ask them, why is that the case? And they're just worried about potential side effects or the feeling that their pet is on medication long term. And the way I look at it is that I say to them, if we're going to be embarking upon rehabilitation, it's really important that your pet's pain is well controlled. Because if that pain's not well controlled, they're not going to engage and recruit the muscular system in the right way when we execute these exercises that I'm going to give you. And therefore, you're not going to better your return on your investment by withdrawing medication. So get that medication, get the pain well controlled. They will be able to engage in exercises more effectively. And when they're strong enough after engaging in a period of rehabilitation, it may be at that point we can start to consider withdrawing that medication a little bit alongside your vet's permission. So obviously this is where the team works so well. We have to communicate with each other and make sure we're doing what's right for your pet.
Yeah, that's really, really helpful because it's such a common situation.
I know, and I don't know, I'm sure it'd be great to do a questionnaire, I think, and find out a bit more about why people think in that way. I'm sure there's lots of other reasons that I haven't suggested, but it'd be really nice to understand the psychological, mindset behind that, I think is what I'm saying. Aerobic exercise, let's start upon what you can do regarding exercise at home when you take your pet out for a walk. And I think when we talk to you and ask you about what exercise you're doing at home with your pet, we'll ask you how long you're walking your pet for and how often, but also we want to know what type of exercise you're doing. Is it on or off lead? Are you playing with a ball and chuck it? Is there a frisbee involved? Is there other dogs they're playing with? What is it they're actually doing? Because we might need to suggest some changes to that in the hopefully, short term, but it may be possible that we might suggest that in the long term too. So ideally, when we're exercising our pets, we want to have a low impact type of exercise, particularly if they've been diagnosed with osteoarthritis. And that's purely really to try and minimize the impact on the joint, which will slow down the progression of any disease. We want them to be short and regular because Osteoarthritic joints don't like being kept immobile for long periods of time. So we want to try and see if we can lubricate them, make sure there's lots of good nutrition being circulated, and they're not going to get stiff, which can be very painful for them. We don't want any weekend warrior activities. So, what might be achievable in the week, 20-minute walks twice daily, then come to the weekend, the whole family's at home, you're going out for a 2-hour walk. We'll be questioning what the impact of that on your pet might be. We want to avoid jumping, leaping, quick turns and running, hence the reason for asking whether they're going to be interacting with other dogs or playing with toys and balls. And then we want to look at what you're doing in terms of warm up and cool down and monitoring for signs of exertion as well. And one other question I will ask my owners is, what does your pet do after exercise? So when they've come back and they've had 30 minutes rest in their bed, what do they look like when they get up and move around the kitchen again? Are they looking quite stiff and sore, or are they as good as they were before they went for their walk or at the beginning of their walk? Because if they're stiff and sore, that suggests that they've likely done too much that joint can cope with. So you potentially have created a small inflammatory flare-up within that joint. So we'll be suggesting a reduction in or a modification to the exercise, probably based on that feedback. Okay. Just wanted to slip this slide back in, which looks at the importance of the neuromuscular system. And a lot of you will be asking, what is that? But it's defined, so neuromuscular control is defined as a subconscious integration of sensory information that's processed by our central nervous system. And that will result in controlled movement through a coordinated muscle activity. So it's a motor response to a sensory input. And happen here, impairments to the neuromuscular system can change movement patterns and increase the risk of injury, hence the importance for maintaining good muscular strength and support around those osteoarthritic joints. And a delay in the neuromuscular reaction time can result in dynamic joint instability as well. So if our muscles aren't contracting and working in a timely fashion, and I describe often a circumstance when a dog's racing across the park towards your dog and can't stop in time, and it's suddenly thrown itself into the side of the body. What's the impact of that on the joints if your muscles aren't able to contract quickly enough to that unexpected situation? So that's going to add significant load to the joint and potentially cause some short-term problems as well. So injury can also interrupt the interactions within the neuromuscular system and cause altered neuromuscular control, and hence the cycle that you can see in this diagram here, that may be a vicious cycle that you encounter with your own pets. Exercise prescription. So looking at effect sizes for different exercise types. So there's a couple of 3 graphs here that look at different types of exercise. So we've got quad strengthening or lower limb strengthening, we've got strengthening and aerobic exercise, we've got walking programs, and then other, which wasn't clarified in this study. So basically, we can see that there is no real significant difference on pain and function between the type of exercise a patient undergoes in the osteoarthritis. So any form of exercise is going to improve pain and function. Then we look at, again, the top right, a different study looked at aerobic strengthening and performance. And there was 48 trials that were included in this. And they, again, found there was similar effect sizes on pain and function. But what they've noticed in the same study, that there was a significant benefit with a single type of exercise over a combination of exercise types in the same session on pain and function. And I think a single type of exercise in a single session is what they were suggesting, ensures that you're doing one thing well. Now, okay, this can apply to ourselves as people. And what they're suggesting is that if you try and do some strengthening exercises with aerobic exercise on the treadmill and something else, then are you doing all those things well, or are you compromising how well you can do one because you're trying to cram it all in at once? So I think that just needs to be carefully considered about how many exercises you're doing in your pet's rehabilitation session. You might be given a series of exercises to do at home. Be practical, look at how demand on your pet and fatigue. Maybe just pick 2 or 3 and do them well, rather, single exercises, rather than trying to do 7 or 8 that have previously been suggested. So I think it's just looking at it from a different mindset. So recommendations across those 3 systematic reviews were suggesting that intensity ideally, and obviously this is once you've built your pet up and conditioned the body to these types of exercises, and they're up to a good level of exercise without incurring any problems. It's ideally a maintenance you'll be looking at 3 times a weekly, or that's what I tend to suggest. They were finding that there's no difference between high and low intensity exercise, interestingly enough. And both high and low intensity had a greater effect on pain than any control groups within those studies as well. But I think you do need to, and this should be very carefully considered, you need to consider what is right for your pet, understanding their diagnosis and where they are in the progression of that. So in terms of delivery, and again, this is people, remember, so they were suggesting that 1-to-1 sessions and greater than 12 treatments had a greater effect on pain and function. Now, that isn't really necessarily going to be practical for many of our pet owners. And a lot of it will be done at home, because we try and give you as much to do at home as possible. But we're there also to guide you and make sure that we teach you the exercises effectively and make sure that you're doing it absolutely correctly to ensure that you're engaging those muscles. Because, if we've got a dog that isn't set up for the exercise correctly, you've got a standing exercise, but he's got one leg out to the right, a left hind out to the left, and he's not square in his forelimbs and hind limbs, then you're not going to be engaging the muscles correctly in the fashion that you would like to. They're suggesting that a minimalistic approach, just a home exercise program, is ineffective and there's no benefit after 6 months. But if it's practical to do so, make sure that you do check in regularly with a physiotherapist. And it might be every 2-4 weeks for some, it might be every 3 months for others. So, or 6 months or even longer. But I think it's just important to stay in touch and maintain that communication between them.
Yeah.
Exercise recommendation, we really know that there was not much difference between the type of exercise, and you can combine strengthening aerobic and flexibility exercises, but don't try and do them all in one go. So ideally, different types of exercise on different days. And yes, supervised exercise is recommended, but remember, you, the pet owner, will educate you, we'll get you as executing those exercises well, and you're the supervisor, essentially, making sure that your pet's doing it correctly. Exercise 3 times a weekly, so that's what we'll be working towards. And yes, 12 one-to-one sessions in human medicine is recommended, but might not necessarily be practical for our situation. So again, just a point of note, but not to be taken, completely into our veterinary field. So how do we set you, the pet owner, up for success when it comes to executing exercises at home? We want to educate you on the benefits of these actual exercises. So we'll be teaching you and educating you on why it's important these exercises are done. A lot of the time I try and incorporate exercises or specific exercises into a daily walk. It's more practical. It's going to be more functional as well, a lot of those exercises. And so hopefully it's going to allow you to be more compliant and help. It helps you really deliver what we're asking of you. And we also want to make sure that you've got equipment readily available. If we're advising specific exercises that does require equipment, is it readily available at an affordable price as well? So, and is it going to be practical for you to do that at home? So weight management. I just wanted to touch upon weight management because this is really important. And there's a few points. I had we were lucky, the team and I had a person come and speak to us, a veterinary nurse who works for Royal Canin. She came earlier this week to have a chat with us. And gosh, it blew me away, actually, how much I didn't know about weight management and obesity. But these are a few points that I took away. And I think the way she was phrasing it, and the veterinary industry is now changing the way that they talk about obesity and overweight and obese dogs,
is that, you know, when they're talking to the owners, is your pet suffering from obesity? And we're trying, you know, I think using that medical term, suffering from obesity, hopefully will sort of highlight the importance of looking at weight as a serious condition, really. You know, we need to address this as a problem if you have a pet that's overweight or obese. Yeah. And it is now being termed as a disease as well, the incurable disease. And I've heard a lot. He works at the University of Liverpool. There's an awful lot of research into weight management and obese dogs and cats too. But it's now being termed as a disease, and that was only fairly recently, in recent years. It was a term that first brought about by the WSAVA, so the World Small Animal Veterinary Association, at one of their conferences. So, and now we, you know, I think it's started to become a broadly used term, the incurable disease. And what was interesting is that she was saying the prevalence of obesity in the UK, and I can't remember the exact year she was quoting this, but she suggested that there's 65% of dogs in the UK are classified as overweight or obese, and 39% of cats. However, she has said that she feels that could go up by 10% since COVID has come about. And that's just because we've been at home, you know, our dog's been looking up at us at the table while we've been working with those puppy dog's eyes, you know, looking like they're hungry. You know, we just reach for something to keep them, you know, happy and content. So, you know, I can see that's possibly the case as well.
Yeah.
So it's so I don't know whether you see that in practice, Charlotte, yourself. Are you seeing?
Oh, absolutely. Yeah, I think it's gone either one way or another. Either people are at home, so the animals have got a lot more exercise, or they are at home and so they've been absolutely pampered to death. And I think people are realising it, how much an impact their weight has on their overall health. Yeah. And I also find it's a really useful target because you can put a number on it, and so they can have a target to go for. So it can be helpful to have that if obesity or being overweight is an issue and they've got arthritis, it's something we can aim at. But it's certainly something that adds to the problem, and it's something massively to focus on.
Absolutely. And then I think the reason we wanted to address this weight is not only because it's the impact on the joints themselves from the extra load that dog's carrying, but also it's the adipose fat cells we know are drivers, as this slide suggests, you know, is stating it's the drivers of the inflammatory process, and so those inflammatory markers are increasing within the body as well, and making, you know, enhancing the progression of osteoarthritis, unfortunately. Yeah. So the initial adipose tissue expansion is physiological in the body, as the first point suggests, but the continued expansion is pathological process occurring within it. And an example is such as hypoxia, which is a reduction of oxygen developing within the expanded adipose tissue, the fat tissue, and that provokes the abnormal release of adipokines. And in conjunction with other fat deposition in the other organs, this triggers dysregulation of the metabolic, hormonal and inflammatory processes, which can lead to our adverse health consequences like osteoarthritis and diabetes and other conditions as well. So that's really important to know. Now, when it comes to weight management, I think a lot of us think just a 20% reduction in calories isn't, you know, and volume that we're giving to our pets is enough. But what she was suggesting is actually you need to be reducing the volume by 30 to 50% for weight loss to occur. But what we need to remember is, though, the reduction in the volume of food equals reduced nutrients. And that can have a negative impact on weight loss as well. So have a discussion with your vet about the right food products to use if you need to address weight on a very serious level. You know, your pet is very overweight. Look at different foods on the market out there. You're looking for a food that's nutrient dense, so they're maintaining the right nutrients, but it's low in energy. Now, I wasn't aware of FEDIAF, and FEDIAF is the European pet food industry, because in the UK, pet food is not very well regulated. And again, I didn't know much about this at all until we had this conversation. But and there's three main food brands in the UK that are FEDIAF regulated, which means that they're ensuring that it's a well-balanced diet, guaranteed to provide the right nutrients for your pet. And they'll have different products within the ranges as well. But do speak with your vet, because they should have a good insight into the right food products on the market. The other thing I just wanted to suggest is, or highlight here as well, I think protein is really important as well for making sure that that's included in the diet as well. So, and that's, you know, an important nutrient, because if there's not enough within the diet, it induces a metabolic upset, and it can eat away at the muscle enzymes, which then results in muscle atrophy. So that's going to have a huge negative impact on managing of osteoarthritis as well, because if you're getting muscle atrophy, which is another term for wastage of the muscles, you're increasing the load on those joints. For those of you that not already seen this is a body conditioning score. I just took the medium dog one, but they do have a small and large dog as well. And you can see how I might score yet, but obviously we don't want anything 6 and above. So if you can pull this up at home, have a look at this and read it in more detail, and stand your pet next to you and have a little look and see if you can try and score your pet against that scale, because anything on that score of 6 and above, the life expectancy of your pet, if they are scored 6 and above, is lessened by 2 years. And so that's really quite a stark reality when you hear that figure. But it is true, and I think we need to address this situation.
Yeah,
I think
that is a long time. That is a long time in your dog's life.
Absolutely. You do at home, and cryotherapy and heat therapy is easily available for us, and can be really effective for pain relief. Not necessarily long-term pain relief, but certainly short-term pain relief. We do know it's medically useful and it's scientifically sound as well. So particularly for cold therapy, we would use cold therapy in the situation when you've got a dog that's been exercised too much, or it's encountered another one of its friends out on its walks, and it's been really interactive with them, very playful for a good 20-30 minutes, and he's come home and has been very sore when he's got up after a rest in his bed. So if there is an indication that's an acute inflammatory flare-up, that's when I would suggest applying cold therapy for the first 24 hours. And we know that it can reduce pain. And what it does is there's these transient receptor potential channels that we know are located on the end of the nerves, so the sensory nerve endings. And if those are stimulated by cold, it'll alter the receptor encoding or the transduction or transmission of painful stimuli. So that's how, the effect it's having on pain. It can reduce muscle spasm as well. So when the cold is applied to a muscle, what it's doing is inhibiting the motor reflex loop. So what it does is, if you've got a muscle that's in a state of contraction or spasm, the motor reflex loop is maintaining it in that state, and the cold will inhibit that, so it'll reduce the effect of that. You've also got a reduction in metabolism as well, and reduction in blood flow. So you're minimizing blood flow, you're flushing out you're reducing the inflammation in the area and edema, and you're reducing extensibility as well within the tissues. And also nerve conduction velocity is reduced as well. So with heat, obviously you can still have an effect on pain and reduction in muscle spasm, but everything else is increased. So your metabolism increases, your blood flow increases, inflammation, edema, extensibility, and nerve conduction. And when we would use heat, I would use heat normally in a situation when a dog's been inactive overnight, first thing in the morning, they're getting up particularly stiff and sore.
I normally use it to lubricate the joint, increase blood flow in the area, flush out any inflammatory mediators out of the area as well. So that's when the heat can be particularly useful. And the effect, I suppose, going back to the pain gate control theory we talked about previously, heat is one of those modalities that could be used to tap into the large the large nerve fibers to override the knockies, the small afferent nerve fibers, which will block that pain travelling to the central nervous system up in the brain. Next, what we've done so far is we've covered modalities and treatments and recommendations for what you can do at home with your pet. And so hopefully all those things are accessible to anybody, whatever budget they may have. The last few slides I'm going to be covering are really other things that we might add in after we've covered the core treatments, I suppose is what we're saying. So I particularly like hydrotherapy as a treatment modality for dogs with osteoarthritis. It allows us to place your pet into an environment where we're minimizing the load on those joints, but still allowing them to exercise against gentle resistance of the water to improve muscle strength. Now, there's research that's now evolving that shows us that we're not necessarily strengthening all the groups of muscles that we'd like to, but certainly as we learn more about it, we're using more advanced techniques, particularly in the underwater treadmill, which is what we have at work, to try and see if we can activate those muscular structures through adding in resistance in other ways, maybe introducing some gentle reverse walking as well, so engaging the gluteal muscles, enhancing the proprioceptive system, so the awareness of where the joints are in space. So there's other tools that we can draw upon to achieve our goals essentially. You'll see that temperature on this image, we exercise within 28 to 32 degrees Celsius, and that allows for increased blood flow, cell metabolism, and toxin elimination as well is increased. It will provide pain relief for your pet and will induce some relaxation as well at that temperature. The surface is and at the surface harder to pass through, so that's sort of the resistance that you're getting, as well as the viscosity. And so the viscosity as well supports the patient. It slows movement down as well, which is why you can see and analyse gait much more clearly in the underwater treadmill setting, and also minimises the risk for sudden turns and falls. So if you've got a weaker patient as well, placing them into this environment will be a lot safer to exercise. So the hydrostatic pressure will also help improve their posture as well and support them, whilst also improving sort of venous return and swelling. So if you've got swollen joints as well, it can help those areas. And then the buoyancy, as we've already talked about, is the upward forces reducing the impact on the degenerative joints. So you're supporting those sore or weak patients. We've got some massage, stretching, joint mobilizations, which are types of manual therapies. And essentially we utilize all of those. We might perform massage in the treatment session, but we also might educate you, the pet owner, on how to perform some massage techniques at home to try and help manage overactive structures through your dog's intent to offload those sore joints. Stretching could be also utilized as well to maintain range of motion and muscle length in the soft tissues. So we want to try and maintain those to maximize your patient's function, your pet's function, and allow them to continue to get in and out their bed easily, get into and out the house comfortably, to toilet. And so that's really important too. And then joint mobilizations are sort of a fancy term for sustained, we call them rhythmical and passive movements, which are performed to your pet's tolerance. And we can do them in the plane of motion that the joint will go in, or we'll do it using our knowledge of the shapes of the joints to do an accessory motion, which is a slide and glide within a joint, and that can help reduce pain and certainly we know that's to be the case in the short term, but not necessarily in the long term, but can certainly provide some pain relief. This slide, I didn't know where to leave this in. It's a bit busy. Just don't worry too much about it, but I'll just summarize. Basically, this is a model that was composed by, I'm never going to get this name correct, Bialowski, and he used manual therapy research at this time in 2009. And basically, it suggests some mechanical stimulus from manual therapy will initiate a number of potential neurophysiological effects, we call them, to provide a sort of desired clinical outcome in the treatment of musculoskeletal pain. So we know that the peripheral nervous system and central nervous system are very complex, and combined, they're responsible for the pain our pets experience. So what we do know is that we do get this hypoalgesic effect, which is the lessening of messages to the brain and the impulses received in one place. And we do know that manual therapy will reduce that, which is great. So don't worry too much on that. Now, other tools that I might consider as well are laser therapy. I might add in as well. Now, I don't very, very rarely use laser therapy as a standalone treatment. I'll always use it as an adjunct to other treatments. And so, for example, I might do laser therapy prior to hydrotherapy to optimise pain relief, because I want my patient to be as comfortable as possible whilst we're engaging in that rehab. Remember what I said earlier about making sure as pain-free as possible, or as low in pain as possible, so they can engage in the activity that we're asking them to perform in. So what is laser therapy? Well, it's the application of specific wavelengths of light for a therapeutic effect. And what it's doing is interacting with tissues at a cellular level and will increase their metabolic activity, which also improves the transport of nutrients across what's called the cell membrane. So we do know that it increases production of energy, which results in a cascade of effects to improve that cell function. So getting that cell doing their job much more effectively. And in doing so, it's enhancing tissue healing. We're looking at improved pain relief, and it's boosting the immune system too. So we also have an anti-inflammatory mechanism by inhibiting the release of pro-inflammatory substances like cytokines, for example. And so it's having an effect on that. It also reduces the oxidative stress imbalance as well that we know can occur within the body, and it sort of counteracts the harmful effects of these free radicals through neutralization by antioxidants. What's in the literature? So again, we don't have much in, well, we've got two studies I've got in the later slide, but in animal models, but in people in osteoarthritis, we do know that low-level light therapy or laser therapy, or photobiomodulation therapy as it otherwise might be termed, reduces pain and disability in osteoarthritis. And this is a systematic review, fairly recent, 2019, where they had 22 trials. So they had 1,060 cases to examine, and so they did, as I said, found that it reduces pain and disability in the osteoarthritis. This is another one which is hot off the press only earlier this month, and it looks at the effects of low-level and high-intensity laser therapy as an adjunct to rehab exercise on pain, stiffness, and function in NEOA. And both of those modalities, low-level light therapy and high-intensity laser therapy, are beneficial as adjuncts to rehab exercise in reducing knee pain and stiffness and in increasing function in the management of NEOA. So that's really encouraging. In animal models, there's two papers, fairly recent, 2018, 2019. So the first one looking at the effect of it on cartilage within osteoarthritis. And they found it did have a positive effect on cartilage under the proper irradiance and adequate irradiation time. So basically, the results demonstrated a positive effect on the cartilage quality, which is the structural integrity, and chondrocyte, which is the cells within that cartilage distribution. So that's what they found.
I think that answers one of we had a question actually about this. Oh,
what
sorry,
was that?
sorry, Di.
Have you got that question?
Sorry, Di. Oh, it broke up. Yeah, there was someone just asked a question just a few minutes ago about how effective is laser, and you have just perfectly answered that question. Really, I think the ultimate answer is it is helpful, probably, but not on its own. This is a thing with arthritis, is that there's no one thing on its own that sorts this out, but it does help.
That's it, and that's why I don't use it as a standalone. I always use it as an adjunct, because I think that's when we get we know we get the greatest effects of it. So, and then the last study was that we can in canine elbow osteoarthritis, which a lot of I'm sure a lot of our viewers may be familiar with. It has a greater reduction in pain, and it tells us that we need to be delivering 10 to 20 joules per centimetre squared. So whoever's delivering your laser therapy to your pet will understand what that means. And over 6 weeks, it was successful in improving lameness and pain scores and in lowering non-steroidal requirement in canine elbow osteoarthritis patients. So that concludes my slide. I've got one last just so you a bit of insight into how we run our pain clinic at Davies. So as I mentioned before, we work alongside the anaesthesia team, and this probably gives you an insight into sort of the first session, which can be up to 90 minutes, where the physio and the anaesthetists are working together. So I'll stop talking and have a little rest for a second, just take a sip of water. I'll just let this play. Thank you, Charlotte.
No problem. That was amazing.
Any questions? I'll just stop sharing if I can work out how to do that. Bear with me. Have I stopped sharing?
Yeah, it's back to us. Fabulous. It was so helpful. We see cases of arthritis every day, and it's so easy to go, we're onto these courses of pain relief, but actually we're forgetting just so many things we can do. And to work alongside, it looks like an amazing facility. To be able to work alongside a physiotherapist, it just gets the best possible outcome for our patients. It does take a lot of hard work. I think that's the thing. If you've got to be really committed to doing this and committing to, like, for example, starting with 3 days a week with these gentle exercises and implementing care plans, but that it has a massive impact, which is really, really encouraging, really.
I would say the exercises, going back to that, I mean, we do normally suggest more frequently to start off with, purely because we're on really low repetitions and low demand, and we're just trying to slowly condition those tissues to tolerate gentle loads, which will then be progressively increased. So we might be suggesting doing 5 repetitions of, for example, sit to stand. It might be a raised sit to stand, or it might be a full sit to stand, and that might be 3 times a day to start off with, and then they will be increased incrementally according to your pet's tolerance. But yeah, ultimately, comprehensive plan and maintaining you've got, it might be 3 times a week. That was what recommended in human medicine, but it might be that a daily regime is beneficial for your pet, in addition to your normal aerobic exercise. Of course, this isn't a replacement, this is in addition to, so these are more targeted exercises you're referring to.
Oh, brilliant, thank you. I'm just having a look to see if there's anything else we can go through. Lots of people all over the place joining us from Scotland. Let's go back through here.
While you're looking, Charlotte, I was just going to say, I think if I'm, asked back to do any more talks, I'm happy to take any suggestions on a topic or anything that anybody would like to learn more about. I love digging out the research and delivering it. So I am happy to do that on your behalf. If you just pop some suggestions in the chat, I'm happy to look through them later, and we can cover that as long as it covers osteoarthritis.
That's fabulous. Yeah. No, we've got some thank yous and some brilliant presentations coming up here.
There's no questions. I hope I've delivered everything that people were
expecting.
No,
it was so informative. There are a few questions that were about general arthritis, not really involving physiotherapy, but about diagnosing, really. I think the difficulty is there is no one easy answer to a lot of the questions relating to arthritis. So this is a particular question about, is it, can you how do you diagnose it? And it's a process, ultimately. But, once we've got to that discovering what the problem is, this is when the physiotherapy comes in, because we can implement changes to day-to-day life that can actually have a long-term big impact on that disease process, and hopefully just give a better and longer quality period of life, which is what we're aiming for. Yeah,
it's a difficult one. As a human physiotherapist, we were allowed to diagnose, but it's not something that we can do in veterinary medicine, and we obviously work alongside your vet. And if there has been a situation where we've examined the patient and it hasn't been identified before, so we're picking up, as I term, the clinical signs. So, and what I mean by that is there's some muscle asymmetry present that doesn't is unexplained. There may be a reduction in range of motion with a hard end feel. So if I'm looking at the elbow, if I flex the elbow and I feel that there's a stop before I feel there should be, so it's not going as far as I feel is within normal limits, then and there's a hard end feel behind it, then again that's another clinical sign in my eyes as well. And this sorts of information I will then back and say clinical signs, there's just within a joint. I can't say osteoarthritis because I've not made a diagnosis. We've not done any radiographs. We can't confirm that. But there's something that's changing presentation, and working together. That's how we will help come to a diagnosis. So with your vet.
Yeah. We have a couple of questions about. Let's bring this one up so we can see it. So I do open water swimming. Would this be effective for my dog? Just thinking of the benefits of cold water for arthritis. I think this is actually a relatively common question I get, because people, if they can't afford to, or they can't commit to doing hydrotherapy sessions, they're like, well, my dog actually likes going swimming in the river or in the lake or even the sea. Is this something that is obviously it's not going to be as a controlled environment? Is it something that people can still use?
I'm not adverse to it. What I do normally suggest when owners ask me that is that I suggest that they go to a hydrotherapy centre first in a controlled environment to start off with, and work with your hydrotherapist and talk to them about, if you were to undertake that, what would their recommendation be? Time out in the water? How would you encourage your pet back to the side for rest periods? Also the time of year, because I think you're right. Cold obviously is effective for osteoarthritis, but that's in a targeted location. So you're using ice therapy or cold therapy to a specific joint. And obviously when you're immersed, your pet's immersed in water, there's a lot of effects on the rest of the body, like the heart and, cardiovascular system. The aerobic respiratory system as well is being, there's an increased challenge on that. So your dog's got to be fit to be able to undertake those challenges too. So go have a few sessions if it's practical to do so with a local hydrotherapist. Discuss about the practicality of being able to do something near home, long term, and within the warmer climate.
Yeah.
And that would be my recommendation. But there is a paper that's been published that looked at the effect of one swimming session on the elbow osteoarthritis. And even after one swimming session, it had an effect on range of motion and function. So we do know that it's effective for that, but it's doing it in the right way.
Yeah,
I hope
absolutely. Brilliant. We have another question, which is, will exercises help for a slipped disc?
Is that for a person slip disc or a dog slip disc? I'm hoping it's probably a dog slip disc, is it?
I think so, because I think the previous question was relating to a dog. So yes, we'll take it as a dog with a slip disc.
We obviously term it as intervertebral or extrusion. Might have there's difference of disc disease in dogs, but absolutely. So if your dog hasn't presented with any neurological problems as a result of that, and maybe that it's had some signs of pain. I don't know what the history is with this case, but certainly you want to try and see if you can optimize neuromuscular control. So making sure the small muscles stabilize in the spine are strong and effective and switching on in a timely fashion. So remembering sort of circumstances that I was talking about when you're out for a walk, is your dog going to be able to cope with unexpected situation, like a playful situation with another dog, for example? Is its body in a state of readiness to cope with those demands? Otherwise, it might be more vulnerable to further injury in the spine as well. So I think optimizing your pet's health and strength of the musculoskeletal system will be important for managing that disc long term. And hopefully it's I don't know, as I said, I don't know the history about it. Hopefully it hasn't encountered any paresis, which is weakness of the hind limbs if it's a thoracolumbar disc, or plegic. So, but yes, it'd be helpful to know a little bit more. But certainly if they have encountered any weakness in the hind limbs, then more important to try and restore as much strength and function in those hind limbs as possible. I hope that helps.
And another one that's actually quite interesting. So this is looking for recommendations for a 16-month-old intact dog who's had a full rear leg amputation. So we have a little 3-legged dog here that's...
Oh, okay. So I think long term it's looking at how that's going to affect the dog. So obviously he's now a tripod, as we call it. There are some websites... I don't know the address off the top of my head, but there are some websites. If you put in tripod into Google and a couple of other search terms like dog, or I'm sure you'll come up with them. But there's some lovely sort of advice sites out there about how to manage patients with 3 legs, particularly from America as well. But in terms of how it's going to affect the opposite limb, we need to be considering that. So we want to make sure that it maintains strength in that hind limb, because it's, that's the propulsive forces come from the hind limbs. And if it's now only got one hind limb remaining, a lot of its propulsion and ability to get up from lying to standing, and when it's walking and if it does enjoy power and strength in that hind limb, optimizing strength there, minimizing loading forces on that limb, so the progression of osteoarthritis, because it is subject to increased loads now. If we look at the dog as a whole, we have 60% of its weight is carried on its forelimbs and 40% on the hind limbs. But now that 40%, really is almost over one limb. There's probably a little bit of what we call cranial weight shift, which means that some of its weight will be distributed onto its forelimbs, but there will be the majority on that remaining hind limb as well. So we need to try and see if we can protect those joints long term from osteoarthritis. If it does get to a point later in life where he starts to become a little bit weak, some assistive harnesses, the ones similar to the ones I was demonstrating, may be helpful to just help facilitate whilst negotiating steps or stairs, if that's unavoidable. But I think it's thinking about the type of exercise he's being allowed to do long term to look after those joints in the future for him.
Brilliant, thank you. Yeah, we're getting some thank yous through as well. Right, I think we're done. think that was really helpful, really informative, and yeah, I think it's hopefully going to provide a lot of information and insight into the options that people have available and the amazing work that you do. So yeah, thank you so much for joining us this evening. It's
Thank
been
you.
our pleasure. Yeah, absolutely lovely to meet you as well. Finally, I just want to remind everyone, obviously, if you want to have a look back at this video or have any look at any other the discussions we've had with Di, have a look on our YouTube channel, because they're all there. You can have a look back on them and see what else is going on there as well. And yeah, I want to thank you so much, Di, for joining us. And yeah, well, I'm sure we'll see you soon again in the future.
Thank you so much, Charlotte, and thank you everyone for listening. And yeah, I'm always do pop any questions that you think of afterwards in the chat, and I'll try and come back to them.
Brilliant. Thank you very much, everyone.